I suppose it is time I welcome all of you again. Today we have a very eminent consultant in pain medicine, Dr. Aanchal Sharma, to give us a talk and to explain how we can manage our pain. And pain actually has an emotional connotation. Pain जो है दिल से आता है, चाहे वो अब वो कहीं से भी वजह से हो रहा हो, चाहे वो घुटने का हो, चाहे वो नस का हो, चाहे वो हेडेक हो, तो वो उन सब में एक इमोशनल कॉनोटेशन बहुत ज़्यादा होती है. पेन के साथ में जो हमारा इमोशनल आउटबर्स्ट भी बहुत ज़्यादा होता है, तो दोनों चीज़ें एक साथ में मैनेज करनी पड़ती है. पेन इन द सेंस फिजिकल पेन और इमोशनल पेन. आज डॉक्टर आंचल शर्मा पेन मेडिसिन की स्पेशलिस्ट हैं वेंकटेश्वर हॉस्पिटल में. She will explain to us how and what causes pain and how we can manage it. Dr. Aanchal, are you there?
Yes, yes.
A very good morning to you.
Thank you. Good morning
to all those who have joined us today for this very important session on pain management. Over to you, Dr. Aanchal.
All right. Thank you, Dr. Shweta. All right. So today we'll discuss about managing physical and emotional pain. As Dr. Shweta said, I work as consultant in pain and palliative care. I did my anesthesia and then I did my fellowship in pain medicine from Chicago, US. And I'm currently American board certified and I'm practicing pain in India. So let's talk about it today, the way we'll discuss it. I'll discuss the physical pain, like different causes from head to toe, and then emotional components associated with chronic pain. And then a little bit about the prevention and how, and just the touch about on the treatment, what we can do about it. So coming to the head and neck pain. So first, this, I'm sure this picture is like very familiar. Everyone has this kind of pain. So usually if you have neck pain, like not even the neck, like upper part of the neck, and the pain is radiating in the front. So that kind of pain could be because of the nerves present in the back of the head. So that kind of, because there is a nerve there which could be swollen or which could be tender. So, this picture shows the nerves which are present there at the back of the head, and that you can see the, how the nerves are there and how they are spreading up, and that's how the pain distribution is as well. So this another picture is showing just a small injection. Of course, it's a, just a representation. We do it with the help of ultrasound. Otherwise, how would you see the nerve? So with just a small injection around the nerve, and you just open up the compression of this nerve, and then this pain gets relieved. And then another is trigeminal neuralgia. And seeing this picture, you would see, or the person would think by himself as well, that it's a tooth pain. It presents like that. Then patient mostly go to the dentist. So it feels like you do have some problem in your tooth or the teeth. So you go to the dentist and get yourself checked. Even some people get to the extent of getting these teeth out, even if they're normal. But still the pain stays. Why? Because this trigeminal nerve, it has 3 branches. Depending upon which part is affected, you suffer pain from there. So obviously, first treatment is medications for this. But once the pain is not relieved with the medication, then of course we go for injections. And then there's another nerve called glossopharyngeal nerve. If you do not have pain here, if you have pain at the, at the back side of your face and lower ear, and then back of the ear maybe sometimes, and you've gotten yourself checked up from ENT multiple times, and you've been told that there is nothing abnormal, your ear is fine, your MRI head is fine, but still you do have a lot of pain there. So this is the nerve pain which is bothering you, because nerve pain, it's usually hard to catch by any investigation. It's your doctor's experience or clinical diagnosis, what we say, which comes into picture in these kind of pains. So Coming to the neck pain, if you have pain in the lower part of the neck and it's kind of radiating to your shoulder, then I just want to show you these bones there. So we all know that these are the cervical bones, right? So these bones have disc in between, but when these bones are behind, they are making the connections in between themselves as well, which is called cervical joints. And when they get arthritic, then you get this kind of pain, and which in layman term we called as cervical as well. And the cervical can affect, if the lower cervical vertebra are affected, then this pain will radiate to the shoulder. If upper cervical vertebra are involved, then this pain will radiate to the back of the neck, what we call as a cervicogenic headache, that the pain is coming from the cervical part. Then there are trigger points. So you see, the whole kind of this area hurts, but then there are specific points, kind of knots. When you feel over them, they feel kind of knots. So the upper muscles, which we call as trapezius muscle, when it gets into spasm and then kind of strain for a very, very long time, then there is a tendency of this muscle to develop small knots. And then these points become painful, and we call it trigger points. And the treatment is just when they are in the early stages, then some physical therapy, have some instruments, physiotherapy, they can just release of those points. But then if they have progressed to the later stage, then we can do some injections to break those knots. Then there is a disc herniation, which is the third cause of the nerve pain. How would you know that it's disc? This is how it feels like. Pain is going all the way the intershoulder area, and the shoulder and the hand, all the way to the forearm, hand. This is how the cervical disc herniation pain would feel like. And sometimes patient would feel, oh, my whole arm is hurting, because the neck pain kind of arm is kind of less, so person focuses more on the arm pain, but it could be coming from the cervical disc. So then chest wall pain, all of us know that if chest is hurting, it could be related to the heart. But if the you have gotten all your tests done, that heart is normal, especially in females, it's I'm not going to say it's not present, but it's unlikely that you would have a heart attack at younger age group. That is possible in males, but because of the hormonal balance we have, it's unlikely, or it's less likely that you will have a myocardial infarction or heart attack at younger age group. But then if you do have a chest pain, which is chronic, which is not going, then your investigations, ECG, and everything is showing normal, then there are nerves here within the ribs. We all know there are ribs here, and within the ribs there are nerves which are called intercostal nerves, and these nerves sometimes get swollen, and the pain you feel like is starting from the chest and kind of going in the back, or starting in the back and coming in front of the chest. And then post-herpetic neuralgia is similar kind of thing. You do have a skin lesions. You can see this virus is causing the skin lesions, and it's kind of damaging that nerves as well. So after antiviral treatment, these skin lesions go away, but not the damage it has caused to the nerve. So for that, we have to be on the nerve treatment. And sometimes with the medications are not sufficient enough to cause pain relief, then we'll have to do what we call as nerve blocks, just with the ultrasound, just directly looking on those nerves and injecting it, and then pain goes away. Then muscle injury, rib fracture, of course, cancer pain, if it's there in the bone, can cause pain. Then coming to the lower back pain, just touch about it. There are spine-related causes, and then there are non-spine-related causes as well. So spine-related causes, discogenic pain. The pain, this could rupture or it could herniate. And as you can see, this is the bone, and then this is the disc in between. And the disc, which is fine, is away from the nerve is fine. But as the disc comes out and it touches the nerves, it kind of gets inflamed. And if it's an acute disc, and by surgically, if you take it out, it actually looks like this only, like pure red. So this is what happens when the disc is touching the nerve, and that's how you feel the pain. Then the spinal stenosis, this whole canal is getting tight because from everywhere, this is a disc, this is the joints getting hypertrophied, like swollen. So the whole canal is getting tight. And then these are the joints, the joints get swollen, where you feel just pain in your back. Then the pain is the worst when you get up in the morning, and or maybe after sitting for a long time, then you get up and there is a pain in the back. So kind of you at the early stage of this facet joint arthritis. And some people do have pain despite the surgery. This is you did have a pain and then you got a surgery done. The pain went away, but then after some time, pain came back, not in the same area, but at the upper and the lower joints. Because when you get the surgery done, you fix that area, and then nothing is going to happen to that area. But then the upper and the lower spine gets a toll. It kind of gets stressed. So those are the joints which get affected after the surgery. And then, of course, cancer and the spinal tumors. Another pictures which shows that, the bone, disc, and these are the joints. So you can see that when you bend forward, these joints open up. But then when you bend backwards, and then you feel pain, that means most likely you have facet joints which are affected, because these are the point which are kind of, getting rubbed against each other when you're extending. So then there is a thigh pain and the groin pain. So thigh pain, the patient describes that the pain is in the front of the thigh, and there is nothing wrong here. You don't see any swelling, redness. All you feel is just pain in front of the thigh and in the side of the thigh. And this is the nerve which is coming out, and you can see this is how we do the injection with the ultrasound. And you just inject a medicine here and you open up this nerve and the pain immediately goes away. So sometimes this one injection is sufficient enough to give the lifelong relief. And if this injection gives relief but it doesn't last that long, then we have another methods as well. But that at least we have figured out this nerve is the cause of the pain. Then we have the knee pain. So everyone knows that the knee pain comes from the knee arthritis. So, the knee replacement, everyone knows that this is the treatment for the if you have the knee pain. But most recently, many treatments have come up. If you haven't progressed to the stage 4 and still, you do have a lot of pain affecting your daily activities, then there are certain treatments. But earlier, it used to be just steroid injections, and that used to give relief for 3-4 months. But now the treatment have come up. You can have, gel injections, which people also call as a grease injection. And what it does is, so there is a cartilage here at the, the cartilage here, and you inject the, gel here, and it kind of, smoothens out the endings. And then the procedure this picture is showing is the nerve injections. So these are the nerves which, travels here, which is the cause of the pain. And if you somehow ablate the pain fibers with the special needles, then what this treatment is called as COOLIF RF, COOLIF radio frequency ablation. And I've given this website, you can figure out more on this website about this treatment. So this is the very established treatment in US, but in India also many people are getting it, so that you can avoid knee replacement for many years, at least 2 to 3 years, or at least an year if your arthritis has progressed. And then what it does is it gives you a chance to recover your muscles. So like, for example, if after radio frequency ablation treatment, you did get a good pain relief, and then you went into physiotherapy, you went into exercises you have been told to do, if not physiotherapy, then you are able to strengthen your, quadriceps, your thigh muscles, your hamstrings. And if your muscles have strengthened enough, then the knee replacement even goes very well. You must have seen people getting the knee replacement, but it takes many months to get back to the normal life. And of course, after that, they're doing really well. But it takes a little while. So if your muscles are strengthened, and for instance, some countries, they have made this protocol that person will undergo this cool radio frequency treatment and then exercises for a few months, and then they do total knee replacement, and then their results are amazing, and then a person gets into their normal life in a very short time. So feet pain, a lot of people have feet pain these days, and there are multiple causes of it, of course. So feet pain comes if it's bilateral pain in both the feet, and it's just persistent. So if you run some tests, like if you're diabetic, if you have HIV, you do have vitamin B12 deficiency, sometimes in vegetarians, and if you have thyroid issues, then if you treat these causes, if your blood test we figure out that you're suffering from these issues, and you do treat the cause along with some nerve medicine, then your feet pain goes away. But then sometimes the feet pain is not in the complete foot. It's just localized. For example, it's just right there in the top of the foot where the metatarsals are. So what we call as metatarsalgia. So this is the nerve, Morton's neuroma, you call it, but then there is a nerve. So it happens in the people who wear heels. Almost they have to wear heels all day long, and when your foot is like this, you have constant pressure on the front foot. So these nerves kind of get swollen, and then when you go to the doctors, you've been told to just take just supplements and nerve medicine. But of course, this pain doesn't go away because it's swollen nerve. So what we do is, with the ultrasound, we just see this nerve and we spread the medication around that nerve, which gives this nerve a chance to heal and a cushion effect. It decreases the inflammation immediately, and it kind of gives the cushion effect to that nerve, and then the nerves get healed. And then if you have pain in the central part, you can see this fascia is going. This fascia is nothing but just a covering over the muscles. Bones are covered by the muscles, and the muscles are covered by this tissue, which we call as fascia. So this sometimes gets inflamed. So wherever it gets inflamed, then you feel pain there. Most of the pain is in the middle of the foot, but you do have pain in the calcaneum as well. And because of this, there are small spurs here, like haddi bad jana jise kehte hain. So then the pain is here, like this person is holding his foot here. This is plantar fasciitis. And then there is a Achilles tendon. The tendon is nothing but when the muscle is connected to a bone, then muscle changes its form and becomes a thick string-like structure, which is called tendon. And then here there is a tendon which is attached. So you can see there is a lot of space here between the bone and the tendon. So that space sometimes gets filled with the fluid, or this tendon gets inflamed, or there are tears in it. Why? Because these are the weight bearing tendons. So you have to, these tendons have to bear a lot of weight the whole day. So these get stressed and, weakened and over the course of time. And sometimes they do get tears. And it also depends the way we walk, how much cushions are we using in our foot while walking. So depending on the cause, you do get early in life or later on, and especially the physicians or any professions who involve standing for many many long hours in a day. So these are the people who are prone to get this in problem. So Achilles tendinopathy. So the treatment is nothing but just an ultrasound guided injection around that area, and you do get relief out of it. So I would say recognize this pain, be alert for, whatever symptoms you're feeling. Sometimes people will feel like a burning sensation. This is true in diabetic, and then sometimes tingling sensation, shooting pain. This is true in case of if person has lumbar canal stenosis, electric shock-like sensation. And then numbness, the whole foot is numb, because you have a disc which is herniating your nerve, and that nerve is getting compressed for a very long time. And that nerves has stopped functioning now, because that's how the nerves are, like nerves are, you feel sensation with the nerves, but that nerves is hyperactive, and then you even touches the pain. You touch the place and you feel pain, because that nerve is hyperactive. But if nerve is like less active, then there is a numb. You do not even feel the touch. So that is how the nerve functions. So a little bit about the emotional component of the pain. So you see this diagram. There is a chronic pain, which leads to, if it's unrated, we're talking about which has been there for a very long time. This anger, fear, anxiety, distress, and all this leads to depression and anxiety, because you're scared. Why my pain is not getting diagnosed? But what could be the cause? And sometimes you're just scared of going to the physician because of unknown diagnosis, or maybe you'll have to take the medicine, and then you keep self-medicating at home, which do not work, because you do not know the cause of the pain. Those painkillers which have worked for your friend or your relative may not be, your diagnosis may not be the same. That's why your medicine would not work. That medicine would not work on you. So that medicine is not working on you could lead to anger, fear, and then you have to work the way you work every day, but then this pain is there, which causes distress, and then you are in depression, anxiety, and then this leads to increased pain perception. So this is what our body goes into this phase when you have chronic pain for a very long time. So your body have some receptors which comes into play only when pain is there for a very long time. So when the chronic pain is there, then at that time, when you have entered this phase, just taking care of pain would not help. Just taking care of diagnosis would not help. At this stage, we have to take care of this receptors as well. That's why sometimes doctors diagnose things correctly, and then the medication is exactly right, but then it's not known, because sometimes patients do not tell for how long ago they started having pain, or sometimes it's since in the busy practice. So this pain perception part is not there. So unless you start medication for this phase as well, along with your medication of your whatever diagnosis you have made, the chronic pain would not be taken care of. So, and this is another good example of having patients having chronic pain, what we call as fibromyalgia. So you have, as you can see, there are multiple tender points, you feel on the body. It could be bilateral, or it could be just on the one side of the body. And you do have stiffness, fatigue, and your sleep is not fresh. And when you wake up in the morning, you don't feel fresh. Yeah, this is an associated symptom. You could have this as a normal symptom as well, and you may not have this diagnosis, but and you get all the tests done in the world, and everything will come normal. And even general practitioners and the people will say it's all in your head, but as a pain physician, you know that it's not in your head, because if person is saying pain, that at least that person is feeling it, so it's real. So dealing with that part, because so I would like to explain it in the way of hemostasis. So hemostasis is like our body kind of maintains a balance. If you are, you get a cut and you lose blood, our body has the mechanism which will tell our brain, oh, there is a blood, send some enzymes or hormones there, or some neurotransmitters there, so that blood is clotted. So blood kind of stays in that fluid part where it's not clotting all the time, and it's not it's not that thin. But if for some reason we do have a problem or disease which in our blood is getting thick, then we have to give blood thinners. And if our blood is too thin, that's bleeding like anything, then we have to give factors or medicines accordingly, so that our body kind of stays in the balance. So similar is the balance with the neuropathic pain. So our brain releases some hormones which allows us to do certain activity, like if I go for 30-minute walk, or I run some errands in my, in my home, or at least and this much of work I can do as per my age, and my body will not hurt in that little amount of work I do. But and brain releases those hormones in which normal hemostasis is maintained. And of course, if you work out too much or do things like this, then of course it's going to hurt. But even if you're getting hurt with normal day-to-day activity, that means that hormonal hemostasis from the brain is not there. So you are feeling pain, but that hormonal imbalance cannot be diagnosed with an investigation. It is a clinical diagnosis, and you do need to be on the medication. So it's not in your head. It's a real pain, and you need to get treated with it. So there are medications and for this kind of pain, and then there is a very wonderful technique called CBT, cognitive behavioral therapy. So what it does is, how we think, because first of all, these thoughts are very important, and a lot of this mind fullness or meditation, or a lot of things have focused too much on thoughts. So it's there has to be something. That's why so many branches of focusing on that. So what we think affects how we feel and act. So that's how we feel and how we act is our behavior, right? And what we do affects whatever we're doing, how we think and feel. Like if you help someone someday, of course you're going to feel good, right? And of course you'll feel good that day, like everything is good, and that's how your emotions will be. Like you'll feel happy that day, and then your thoughts will be, we should help everyone. Like just one example. So if your thought is, I have a chronic pain, and nothing is going to get better ever. So, your behavior will be, you would not go out with friends. You will just avoid all social activities, and your behavior will be just sitting, and maybe you'll cry and when you're alone. And then, it affect your emotions. Yeah, that you'll just stay sad and feel lonely, and then you'll curb your activities, and that will further deepen your emotions. And then these emotions affect your sleep as well, and when you sleep, we don't sleep well, it further affects your thought. Then, I had chronic pain, now I'm not even getting the proper sleep, now I have those issues, maybe I have, some serious diagnosis, maybe, everybody's going to leave me, something like that. I'm just giving examples. So these are the thoughts which person prevails. So what we think, is that's how our behavior is, and that's how our emotions are. So emotions follow these. One person is sad, or it's not because the person has tendency to feel sad. It's just like that thought comes, and then it leads you to do something, and that brings the emotion. So CBT just focus on identifying your thoughts and emotions that contribute to the emotional pain, associated. And that could be any, where that thoughts are coming from. You did have a chronic pain, of course, but that was untreated or undertreated, or you did not get the good guidance, and now it has prevailed like anything, and now the bad thoughts are coming. So CBT, we do treat your physical pain as we discussed the treatments, but then a CBT is something, which focuses on identifying those thoughts which you may not be identified by yourself, and then contribute, and then replacing those thoughts with the realistic thoughts. I'm not going to say positive thoughts, because that's how somebody knows, but the realistic, like if person cannot walk because of the severe back pain, you cannot tell that person, oh no, just think positive and walk. No, you have to be realistic. Let's see how much you can walk, maybe 10 steps, maybe, it's like more adaptive, realistic thoughts and behaviors, whatever you can do, if just into that diameter, so you're not hurt. So CBT basically focusing on changing perception, whatever you perceive, and then how you behave. Because if your thoughts are not right, then that's how your behavior gonna be, and that's how your emotions gonna be. So prevention of these, physical pain, of course, everyone knows that, exercise, how exercise helps. It increases blood flow to the muscles and organs. So this blood flow, anything, We used to do massage in the hair. What massage does, it increases the blood flow. So wherever the blood flow is, the growth is better. So when the blood flow increases to those muscles grow well. Lifestyle modification to daily wear and tear. And what does this mean? Lifestyle modification is like when you sit, your tendency should be, you should be sitting straight, and then if you have somehow bringing that time into your schedule, that you walk at least 30 minutes a day and not using too much of mobile, laptop. And then smoking cessation, because we know it doesn't only cause lung cancer, but it does have a negative effect on bone health and blood vessels as well. And then, of course, posture, we talked about proper lifting technique. This is very important because, if you lift a 20-pound weight, just like this, it's not like your body is going to perceive it as 20 pounds. The way you lift it, if you lift it like that away from you, your body may perceive it as a 40-pound weight. And if you bend forward and then lift it, then it probably becomes 5 times more. But then when you bend your knees, keep the weight as close to you, and then lift the weight, then this is something different, and it's as close to the actual weight it is. So proper lifting techniques so that we don't hurt our muscles, nerves. And then, of course, maintaining healthy weight. Why? Because our weight bearing joints, our lower lumbar, L5, L4, and our foot and your knee joints, these are the joints and areas which carry our weight. So if our weight is healthy, of course, there'll be less stress on these joints. And reduce alcohol intake, of course, eat healthy, and water aerobics. So what about it? So water aerobics is something, when you dip into the water, you feel light, right? Because water takes away your weight. You don't feel right. So whatever exercises like, cycling or, bending your knee, something like this, a person cannot do in a regular setup. If you cannot do, especially it's for the people who are very old or their spine has been hurt and they cannot move. So if you dip yourself into the water, like a swimming pools, especially hot water pool are the good ones, like warm water pools. Of course, on COVID, these are closed, but whenever it opens, the person who cannot do exercises in the regular setup, the water aerobics is very helpful for them. It spends same exercises, you end up spending more calories, and the same exercises you can do with more ease. So these are the basic exercises I just want to touch. If you kind of, if you can't do anything, at least you can do this much, that when you wake up in the morning and you're lying, at least you can, but you have to just see your spine is straight, your knees are bent, and you kind of press, you see these small arrows, you kind of press your back against the floor, contract your buttocks, and then raise them 1/2 inch, then contracts the abdominal muscles. So repeat kind of 10-20 times in abdominal curls. So you see these hands. Sometimes I've seen people using these hands at the back and then bending. So, this doesn't give support. So keep your hands and across your chest, and then contract the abdominal muscles so that your abdominal organs are protected. And then slowly raise the shoulders, not more than like kind of 10 inches from the floor, and do it at least 10-20 times, and then knee to stretch. So you see this hand is on the back of the knee, not in the front. Like people keep your knee like this and bend forward. So and all the 3 exercises, spine is straight, right? So place both the hand behind one knee and then bring it to the chest, and then stop there and count till 10 and then slowly lower. This is kind of like when you start. And then this is a cow pose. And this is a very good yoga pose. It's my favorite actually. You bend yourself, you bend your back, and then you bend it like this. So this kind of helps in core strengthening. Of course, like planks is one of the good one for the core strengthening, but this is one for those who can't do much. This is a very good exercise for the people who have like small disc herniations. So our disc has a tendency to get contained. Even if you have like small disc herniations, this is, if you do these exercises, the disc kind of try to get contained. So these are the good exercises for this, and this is to strengthen, of course, the cobra pose or bhujangasana in the yoga. So this also kind of strengthens the back. So I hope I touched a little bit on the physical pain, emotional pain, and the treatments we can provide. If you have any questions, please type in the chat box and try to answer. And these are my OPD timings. Whenever, if you want to come in the morning or you want to come in the evening, these are the different options. And I've provided with the numbers as well. You can call for the appointment. Thank you very much for your attention.
Thank you, Dr. Aanchal. Thank you so much. It was a very lucid talk. बहुत आपने आसानी से आपने सब कुछ समझाया और आप अलग अलग प्रकार के जो पेन होते हैं या दर्द होते हैं वो आपने सबको समझाए. आपने ये भी बताया कि हमारे इमोशंस जो हैं वो किस तरीके से पेन को मॉडिफाई करते हैं. एक्चुअली पेन क्या है? पेन एक परसेप्शन है और पेन एक नेगेटिव परसेप्शन है. सो बेसिकली जब भी पेन होता है हमारे इमोशनल सेंटर्स थोड़े से एक्टिवेट हो जाते हैं और हमको जब पेन की वजह से पीड़ा होती है तो मन में ही विचलित हो जाता है. तो पेन से एंजाइटी बढ़ती है और सिमिलरली एंजाइटी से पेन बढ़ता है. तो ये एक विशियस साइकिल है. विशियस साइकिल मतलब एक चीज दूसरे को लीड करती है और वो दूसरे को बढ़ाती है. तो कहीं ना कहीं ये जो साइकिल है इसको तोड़ना पड़ता है, चाहे वो माइग्रेन हो, चाहे वो बैक एक हो, चाहे वो जोड़ों का दर्द हो. नहीं तो पेन प्रोलॉन्ग हो जाता है, लंबा चलता है. तो कहीं ना कहीं हमें इस चीज को एट अ टाइम टारगेट करना चाहिए. डॉक्टर आंचल ने बहुत अच्छे तरीके से समझाया कि हम अपने आप को रेशनलाइज करें, हम रियलिस्टिक गोल्स रखें और ऐसा भी ना नेगेटिव में भी ना जाए कि पेन ठीक नहीं होगा, बिकॉज कहीं ना कहीं ये चीजें आपको लॉन्ग टर्म में उस पेन को बढ़ावा देगी. और पेन के जो ब्रेन के एरियाज है वो एम्पलीफाई कर जाते हैं और पेन परसेप्शन और ज्यादा होता है. तो कहीं ना कहीं अपने इमोशनल इश्यूज को सॉर्ट आउट रखना, अपने पेन्स को ये समझना कि ये जोड़ों का पेन है या नसों का, सारे ही पेन नर्व्स ही लेके जाती है ब्रेन तक और हमारे को फील तो वैसे ही होता है. लेकिन कहीं ना कहीं जो पेन का ओरिजिनेशन है, पेन कैसे ओरिजिनेट कर रहा है, कहाँ जोड़ों से आ रहा है या मांसपेशियों से आ रहा है, टेंडन से आ रहा है या फिर नर्व पेन है, उसको हमें कई बार समझना पड़ता है. डॉक्टर आंचल आप बताएंगे कि जॉइंट पेन और मसल पेन हाउ आर दे डिफरेंट, नंबर वन, और नर्व पेन कैसे डिफरेंट होता है. अगर किसी को ये है कि नहीं तो सारे पेशेंट जो आते हैं या जो सारे लोगों को लगता है नसों में दर्द हो रहा है, नस में तो हो ही रहा है, लेकिन शुरू कहाँ से हो रहा है, उसको कैसे डिफरेंशिएट करे, जनरल जैसे लोग कैसे समझे उस बात को.
राइट डॉक्टर श्वेता, एक्चुअली जब तक मरीज डॉक्टर के पास आता है यूजुअली ये पेन ओवरलैप ही कर रहे होते हैं, बट घर पे खुद से समझने के लिए यूजुअली जो पेन अपनी जगह पर ही रहता है, अगर बैक में है तो वो सिर्फ बैक में ही है, अगर नीज में है तो सिर्फ नीज में ही है, शोल्डर में है, जो अपनी जगह पर रहता है पेन वो यूजुअली जॉइंट से आता है. जो पेन रेडिएट करता है, बिकॉज नस एक जगह पर नहीं होती है, वो ब्रेन से पूरा हर जगह ट्रैवल करती है. जैसे कि डिस्क हर्निएट की नस के ऊपर उसने इम्पेंज किया, जैसे कि मैंने पिक्चर दिखाई थी कि वो रेड हो गया, तो वो अगर पेन वो कभी सिर्फ बैक तक लिमिटेड नहीं होगा, या तो sciatica अगर वो L5S1 पे है या फिर ऊपर है तो पूरी टांग में रेडिएट करेगा पेन. तो यूजुअली ऐसा पेन नसों का पेन होता है. और जो नसों का पेन होता है वो यूजुअली रात को वर्सन हो जाता है दिन rather than दिन में, बिकॉज दिन में नसें, हम लोग काम करते रहते हैं, एक्टिव रहते हैं, तो नसें भी थोड़ी सी सटल रहती हैं. जब हम रेस्टिंग मोड में आते हैं तो वही नसें हाइपर एक्टिव हो जाती हैं, तो वो रात को पेन ज्यादा फील होता है. और जो मसल का पेन होता है वो यूजुअली मूवमेंट से वर्सन, एक्यूट इंजरी का हिस्ट्री होगा, अभी अभी चोट लगी, या फिर ये कोविड के बाद काफी माइल्जियास देखे गए हैं. तो उस तरह का पेन जो लिमिटेड स्पैज्म, जो लोकलाइज्ड पेन है लेकिन थोड़े ही मूवमेंट से बहुत ज्यादा हो रहा है, तो वो मसल पेन होता है.
राइट. अच्छा एक बात बताइए डॉक्टर आंचल, आजकल जब से लॉकडाउन हुआ है हम सारे घर पे बैठे हैं, सारे बच्चे भी और बड़े भी कंप्यूटर और मोबाइल्स देख रहे हैं, सबके नेक पेन और बैक पेन, मेरे ख्याल से पोस्चर हम सबका ही कहीं ना कहीं अफेक्टेड हो गया है. कभी बेड पे कंप्यूटर लेके और मोबाइल लेके सुबह से लेके शाम तक कुछ ना कुछ चल ही रहा है हाथ में. तो उसके निवारण के लिए आप बताइए क्या किया जा सकता है.
तो जो हमारी नेक की मसल्स होती हैं वो बहुत ही वीक होती हैं। हम सारे एक्सरसाइजेस करते हैं, हाथ से अपने लेग से वॉक करते हैं, तो कहीं ना कहीं हैंड और उसकी वो फिर भी वो हो जाती है, लेकिन जो हमारे नेक वो है वो काइंड ऑफ इग्नोर हो जाता है और हमारा बहुत ज्यादा यूज होता है। तो सबसे पहले तो जैसे मैंने बोला कि प्रॉपर पोस्चर, जब भी आप लैपटॉप के सामने बैठे, मेक श्योर कि स्पाइन आपकी स्ट्रेट हो। आई नो हैबिट की वजह से हम बार बार भूल जाते हैं, बट कोई भी हैबिट डेवलप करने के लिए हमारा एक ही चीज वर्क करती है, हमें अपने आप को बार बार रिमाइंड कराना। तो हम स्ट्रेट पोस्चर के साथ बैठे। और दूसरी चीज मैं एक्सरसाइज बताना चाहूंगी, आई एम श्योर लाइक लोगों ने सीखी होगी, बट जैसे हम अपने हाथ को जोड़कर सर के पीछे ले जाएं और जोर लगाएं, और कई बार लोग जोर लगाते लगाते हाथ ऐसे कर लेते हैं, विच इज रॉन्ग। तो हाथ स्ट्रेट रख के इस तरह से जोर लगाएं, तो ये ट्रेपीजियस मसल जो हमारी है इस पे स्ट्रेस पड़ता है और ये स्ट्रेंथन होती है। तो फिर फ्रंट एंड ऐसे करना और हाथ इस तरह से लेके जाना, ये अगर हम अपना लैपटॉप पे हम बैठने वाले हैं और हम उससे पहले 10-15 मिनट ये एक्सरसाइज कर ले और हम डेली के शेड्यूल में ऐड कर लेंगे बिफोर स्टार्टिंग माय वर्क ऑनलाइन, और मुझे ये करना ही है। एंड बच्चे भी, इनफैक्ट ये इतना सिंपल है कि बच्चे भी ये एक्सरसाइज कर सकते हैं। तो ये एक एक्सरसाइज अगर आप, और इसके कम से कम एक बार जब आप रख रहे हैं तो मेक श्योर यू डू इट फॉर 30 सेकेंड्स एंड रिपीट इट फॉर 4 to 5 टाइम्स। तो 2 मिनट का एक साइकिल कंप्लीट हो जाता है एंड यू डू इट फॉर 5-6 एंड इट हार्डली टेक 10 मिनट्स। तो ये एक एक्सरसाइज है जो हमारे को हेल्प कर सकती है हमारे नेक मसल्स को स्ट्रेंथन करने में, और प्लस पोस्चर। There are some more questions, Dr. Shweta. Hello.
I was mute actually. I have muted myself.
Okay.
So I was talking but on a mute mode. So कुछ और सवाल हैं, जैसे कि कुछ जैसे हम में से कुछ हैं जिनके फुट पेन्स बहुत ज्यादा हैं, और अब वो चाहे ज्यादा चलने से हो चाहे एज रिलेटेड रहे, और उसमें क्या जैसे कुछ स्पेसिफिक फुटवेयर या सिलिकॉन इंसोल्स आपको लगता है उसमें हेल्प करते हैं?
बिल्कुल। एक्चुअली जो प्लांटर फेशियाइटिस होता है, जो फुट पेन होता है, जैसे कि मैंने अपने I took a little while to describe the foot because foot pain usually ऐसा पेन है कि इग्नोर हो जाता है कहने में कि बस पैरों में दर्द रहता है, लेकिन पैरों में कहाँ दर्द रहता है? फ्रंट फुट में पेन रहता है, बीच में रहता है, या पीछे रहता है, या फिर एड़ी के ऊपर रहता है। तो डिपेंडिंग अपॉन दैट उस कॉज का ट्रीटमेंट ही पैर का पेन का ट्रीटमेंट है। लेकिन अगर पूरे पैर में दर्द रहता है और रात मतलब दिन में सारा दिन काम करके रहता है, तो यूजुअली ये जो सिलिकॉन फुटवेयर्स या कोई जो रेगुलर मार्केट में फुटवेयर मिलते हैं, वो शुरुआत में तो अच्छे लगते हैं बिकॉज यू फील दैट कुशन इफेक्ट और आपको, लेकिन लेटर ऑन जब आपके यू गेट यूज्ड टू इट आफ्टर अ मंथ, तो आपने कभी नोटिस किया होगा जो आपके प्रेशर पॉइंट्स हैं जहाँ पे आपका ज्यादा, क्योंकि फुट का प्रेशर इवन नहीं डलता कभी, हमेशा एक वैसे डलता है कि कहीं ज्यादा है कहीं कम है, तो वो वहां पे गड्ढे पड़ जाते हैं उस फुटवेयर में, उसके कुशन में, तो वो फिर वो हार्मफुल हो जाता है बिकॉज वो अनइवन हो जाता है। तो जो रेगुलर मार्केट में मिलते हैं, दोज आर नॉट दैट हेल्पफुल especially if you have severe pain. First of all I'll say कि अपना पेन, आपका पैरों में दर्द क्यों हो सकता है? आपको डायबिटीज की वजह से हो, तो उसमें सिलिकॉन कुशन्स कुछ नहीं करेंगे जब तक आपका शुगर कंट्रोल नहीं होगा। सपोज आपको थायराइड की वजह से प्रॉब्लम है, या मतलब कॉज को ट्रीट करना सबसे पहले बहुत जरूरी है। और ये सिलिकॉन अगर आपको कोई भी कुशन वेयर पहनना है तो गेट इट कस्टमाइज्ड। देयर आर बहुत सारी जगहें हैं जहाँ पे वो लोग आपके पैरों को स्कैन करते हैं, एंड बिकॉज हर एक का चलने का तरीका, जहाँ पे उसके प्रेशर पॉइंट्स हैं वो अलग होते हैं, they'll scan the footwear accordingly and they'll give you your cushions जो आपके लिए बेस्ट है। So that's my recommendation for it.
Right. Any exercises for joint pain that you would like to suggest? कुछ ऐसी exercises आपको लगता है जो general joint pain, knee pain, elbow pain, foot pain के लिए कुछ करनी चाहिए seniors को?
So as far as seniors are concerned, I would say walking is the best exercise, not the running but the walking, and choose the right shoes, जैसे Nike Air Max हैं, या like जिसमें वो air का cushion effect रहता है, so because there are is something right, choose the right shoes, you know, whatever works for you, everyone knows. और उसके साथ रन करना नहीं, वॉक करना, just brisk walk, तेज चलो या स्लो चलो depending upon, but 30 to 40 minutes walk every day if you can do. And if you can't walk brisk, तेज नहीं आप चल सकते, तो slowly चलना, वो walking is the best exercises. And अगर आपको किसी पर्टिकुलर एक जॉइंट में पेन है, जैसे कि नी जॉइंट का पेन है, तो नी जॉइंट का पेन तो मोस्ट लाइकली ऑस्टियोआर्थराइटिस से ही होता है. एंड सी गेट योरसेल्फ चेक कि वो कौन सा स्टेज है, यू नो, डोंट बी इन द पेन. पेन का कॉज अगर ऑस्टियोआर्थराइटिस है, तो हमें देखना पड़ेगा कि वो कौन सी स्टेज का ऑस्टियोआर्थराइटिस है. तो उस स्टेज के अकॉर्डिंगली गेट द ट्रीटमेंट, एंड देन मे बी यू कैन पार्टिसिपेट इन फिजियोथेरेपी एंड एक्सरसाइजेस रेगुलरली. दैट इज बेटर रादर देन कोई भी एक्सरसाइजेस करना. और कोई भी एक्सरसाइज अगर आपको पेन कर रही है, तो पेन एक्चुअली इंडिकेटर होता है टिश्यू डैमेज का. दैट्स व्हाई इट्स पेनिंग. यू नो, हार्ट अटैक आता है तो पेन होता है बिकॉज अंदर हार्ट का मसल डैमेज हो रहा होता है. तो कहीं भी पेन है, दैट मीन्स सम टिश्यू इज अफेक्टेड. सो आई थिंक फिगरिंग आउट द कॉज, क्यों आपको दर्द है, बाय अ स्पेशलिस्ट is important rather than just, you know, regular treatment, जो overall treatment है. But overall walking is, I would say, is good for everyone.
Right. Any role of nutrition, do you think?
Absolutely. So you know, as I said, eating healthy is important. जैसे last week हमारा nutrition पे पूरा webinar था, and you know, she told very good things about it. So अगर हमारी nutrition ठीक नहीं है, तो सबसे पहले जो चीज हमारी इफेक्ट होती है, वो होती है हमारी मसल्स एंड देन नर्व्स. जैसे कि मैंने बोला कि पैरों का दर्द का कारण विटामिन B12 डेफिशिएंसी भी होता है. So if these vitamin B12 is deficient, that sometimes it causes hand pain as well. तो अगर आपका न्यूट्रिशन राइट नहीं है, तो आपका इट लीड टू योर वेट गेन. और जो वेट है, जैसे कि हमने डिस्कस किया, नी और L4, L5, L5S1, these are the joints which are worst affected with our pain, right? So these are the things which affect you the most. So
Right.
eating healthy, of course, with your greens, fruits, and vegetables is important, and everyone knows it. I know we kind of just keep ignoring it.
Right, you're very right. Actually, जिंदगी इतनी busy हो गई है डॉक्टर आंचल, बस मुझे लग रहा है भागे भागे जा रहे हैं, और बीच में रेस्ट करके प्लान नहीं कर पा रहे हैं. It is more like you're just running around.
Right.
I think we have covered a lot of questions, and if there are any more questions, please either put in the message or you can unmute yourself right now. पेन एक बहुत कॉमन प्रॉब्लम है, और एक्चुअली हम सारे ही परेशान होते हैं. कभी नेक पेन, कभी बैक एक. मैं न्यूरोलॉजिस्ट हूँ, आई सी इट थ्रू आउट, राइट? सो और मतलब कहीं ना कहीं कभी नी पेन, कभी फुट पेन. सो बेसिकली सिंपल थिंग्स दैट वी कैन डू, छोटी छोटी चीजें हैं जो हम लोग रोजमर्रा में कर सकते हैं और उस पेन को हम कम कर सकते हैं. न्यूट्रिशन मेंटेन करना, रेगुलर एक्सरसाइज करना, मेकिंग श्योर यू आर comfortable with your footwear. Do not try to at any point of time wear something which is not comfortable. Again, कुछ चीजें हैं जो कि हमारा एज के साथ डिजनरेशन होता है, बट हम रेगुलर एक्सरसाइज करते रहेंगे और न्यूट्रिशन मेंटेन करेंगे तो हमारे जॉइंट्स और मसल्स हमारा लंबे समय तक साथ देंगे. एंड आई थिंक रेस्ट ऑफ द थेरेप्यूटिक स्ट्रेटेजीज जो कि मैनेजमेंट है, जो कि या तो दवाइयों से होगा या नॉन फार्माकोलॉजिकल होगा, या फिर जैसे डॉक्टर आंचल करते हैं कुछ इंजेक्शंस देके या कुछ रिहैब से होगा. आई थिंक विद दिस वी हैव कवर्ड पेन मैनेजमेंट ओवरव्यू हमने दिया है आज. एंड
I think there is one question, Dr. Shweta. How do you think emotions control pain perception, and does meditation affect pain? I'll just quickly answer that question.
Sure.
Emotions, जैसे कि मैंने बताया कि जो negative emotions है, जैसे general point of view में भी, when you know we get hurt with small, किसी ने हमें बुरा कह दिया, you know, you're not a good, your patient didn't do well, ऐसे करके कुछ भी बोल दिया, you know, but we are happy because of some reason, like maybe my daughter came, you know, first today, just like I'm happy today, and you know, you won't be like आज मुझे किसी बात का बुरा नहीं मानना because I'm very happy, you know. This is just a very small example of, you know, when you feel happy because of some reason, then you don't feel bad which should have otherwise made you feel bad, right? So इसी तरह से emotions जो हैं, when you are in a chronic state of feeling sad because of chronic pain, because अगर आपका especially अगर 45-50 years में आपके पेन्स आपको कर्ब कर रहे हैं, आपकी एक्टिविटीज को, आप सोशलाइज नहीं कर सकते, आप फ्रेंड से मिल नहीं सकते, और मोस्टली यू आर सैड, यू नो, तो आपको थोड़ा भी कोई कुछ कह दे तो दैट काइंड ऑफ मेक इट गेट्स इनटू 10 times into your head कि मुझे ऐसा कह दिया, मुझे ऐसा कह दिया, you know. So that's how emotions does affect the pain perception, because you are sad or you're already suffering, you know. आपको low back pain होता है, जैसे आपको you're with a great effort you're making food despite your low back pain, and किसी ने कह दिया कैसा खाना बनाया, इसमें नमक नहीं है, या something like this. So you're already suffering, and you know somebody is already, so that's how your emotions come into the picture. So that's how it affects the pain perception. फिर आपको और ज़्यादा pain feel होने लगेगा. Like with the disease you're having, you should feel 50% of the pain. Like your VAS score should be 5 out of 10, but it'll increase to 8. And someday your sister will come or your mother will come and they'll, you know, they'll talk good. That pain from 5 will go to 4 automatically. You do have pain, you do have disease, but that's how our emotions affect our pain. And the second question was how meditation affect. Obviously, medication tremendously affect, because it does affect our thoughts. When you sit quietly, you know, meditation is nothing to do with the religion. We know that. So when you sit quietly with just, you know, observing your thoughts, then you can see as a third person that how your thoughts are. Are they usually negative? Are they usually neutral? Are they judgmental kind of thoughts? Are they positive thoughts? What kind of thoughts? So that kind of gives you a lot of energy, especially when you do that in the early morning. When you wake up, try to make it a habit for sitting with you for 30 minutes and just observing your thoughts, just sitting there. And then this over a course of time helps tremendously.
Right, you're very right actually. जैसे ही पॉजिटिव सोचना शुरू करो और अपनी मेंटल थॉट्स को थोड़ा सा मेंटल रेजिलियंस बोलते हैं एक चीज, मेंटल रेजिलियंस मतलब डिसिप्लिन क्रिएट करो, तो कहीं ना कहीं हमारा पेन भी पॉजिटिव थॉट्स के साथ कम हो जाता है और नेगेटिव थॉट्स के साथ बढ़ जाता है. तो ये हमें याद रखना है. और मेडिटेशन मतलब आई सजेस्ट, जैसे कुछ हेडेक्स में होते हैं, माइग्रेन में, या फिर आपके इवन ट्राइजेमिनल न्यूरल्जिया जो आप ट्रीट भी करते हैं, उसमें भी कई बार पेन परसेप्शन कम हो जाता है. सो इट इज मोर लाइक अ वेरी इफेक्टिव टेक्निक इन पेन मॉड्यूलेशन.
Right.
And I think there are 2 new messages. Let me just check. If a person is suffering from osteoarthritis and they cannot walk, then should he try forcefully?
Absolutely not. Absolutely not. Get your osteoarthritis, you know, treated first. Depending upon the stage, there are different treatments, injections, as I said, and radiofrequency ablation in stage 2, 3. And if you have stage 4, then obviously it's knee replacement. Then the continuum therapy, basically get yourself treated first. For that matter, any exercises, even if it's causing you pain, then don't do it, because pain is an indicator of tissue damage.
Right. So basically अगर osteoarthritis है, so अगर depending, अगर बहुत ज़्यादा सीवियर स्टेज पे है तो आपको नहीं करना चाहिए. नहीं तो आप इनिशियली रिहैब और मेडिकेशन ट्राई करें और उसके बाद
फोर्सफुली नहीं करना है, बेसिकली फोर्सफुली नहीं करना.
राइट. I think with this we would close the session and we would take your leave. It was a great session. आपने बहुत अच्छे से समझाया और I think we are going back with a message कि हमें अपने इमोशंस और अपनी फिजिकल एक्टिविटी और न्यूट्रिशन जो है उसको बैलेंस में रखना है, उसको हार्मनी में रखना है. Right. And with this, I would thank Dr. Aanchal, and I would thank all the attendees for this Sunday session. And I wish you a very, very, very happy Sunday to all of you. And next Sunday we'll meet again with something new, something different. Okay.
All right. Thank you so
Bye.
much. Thank you. Okay.
Good day. Good day to you. Good day to all.
Good day.